Back in the early 90s, when we saw healthcare costs starting to go up, we had the concentration of employees in a fairly combined area. So my father decided, let's hire a doctor and let's start a clinic. We set up the clinic, and it was really based on taking better care of our employees. It's all about having the primary care physician at the center of the whole circle, having a relationship with you, and being allowed to practice medicine. When you practice medicine that way and you let the doctor do what they were trained for, you have the extra added benefit of keeping people healthy, which then also keeps cost way down.
My father was my mentor, and he taught me how important it is to develop a relationship with patients. When I was in my private practice with a hospital, they kept asking me, can't you see patients faster? And I said, well, these are complicated patients, and if I'm going to really take care of them, I need the time to cover all the bases. Right at that time, Dr. Len called me up and said, I'm opening a clinic for QuadMed. Do you want to join me? He said, oh, we have those patients and I want you to take care of them. Here I am 23 years later with patients, some of whom I've had for 23 years.
As the West Dallas Clinic began to grow, it became obvious that patients loved it. Certainly this employer loved it. And in 2005, we got a call from the Wall Street Journal saying that they had heard about us, were just curious about us, and wanted to do an article about the QuadMed. Article appeared on the front page of the Wall Street Journal, and it was a game changer in terms of the presence in the market and the prestige of Quadracci and QuadMed. Everything we got was from people calling us, wanting to understand this model, both locally and nationally. Our data was very compelling. We were talking about how to change the outcomes of healthcare.
In the years that I've been with QuadMed has tripled in size, and that's due to not only acquisitions, but many exciting client partnerships, large and small. It's exciting to see that care being spread across the country to new clients and new clinics as we expand and grow. I've been excited about all of the innovative transformations I've seen in QuadMed, all of the advancements we're making as an organization. And yet I've been really, really pleased to see how Quad has stuck to its core values and its core model of delivering really high quality and convenient care to our patients.
If you look at the history of QuadMed, we really started it for the right reasons. It was taking better care of our own. And as we launched it on the outside and continue to grow it, that hasn't changed. And so here at QuadMed, we'll keep you well, but if you get sick, we'll take care of that too. And to me, it's about making sure that together we find a better way, and that's what QuadMed is all about.